time. So we're requesting Dr. ANUSHREE Bhatkal to give the first presentation. While ANUSHREE is coming, please come forward. Just to remind everybody that it is 6 minutes per presentation, and I would say that try to stick to the time. We won't have any question and answers, and the timer will start as soon as your slides are up. I mean, as soon as you start talking. Please carry on.
Good afternoon, everyone. So today I'll be talking on potential treatment of keratoconus.
Just raise that mic a bit. Yeah.
Potential treatment of keratoconus in cellular and animal models using batimastat and trehalose. So we know that keratoconus is a progressive inflammatory corneal ectatic disorder, and it presents in various forms and grades. So we know from our previous work that keratoconus is characterized by ocular surface inflammation, which results in raised inflammatory markers. We've also seen that keratoconus patients exhibit high MMP9 mRNA levels in corneal epithelial cells and tears as well. We have also observed that there is a decreased LOX expression in keratoconus disease. So this raised MMP9 and decreased LOX is basically the molecular phenotype in keratoconus. So we mimic this in a cultured cell line, epithelial cell line, by inducing inflammation by treating the cells with TNF-alpha and LPS. And again, we noticed that there was a raised MMP9 and decreased LOX expression. So basically in keratoconus, the LOX and MMP9, they cause the ECM, the extracellular matrix remodeling. The MMP9 causes degradation of the extracellular matrix, which results in progression of the disease. So this brings us to the research question that what impact exactly does eye rubbing and inflammation have on the cornea? So first I'll talk about the animal model. First, we induced inflammation in a particular strain of mice. We used a cotton swab and rubbed the eyelid of the mice for 12 times each day. And we also gave an LPS treatment, which is lipopolysaccharide, to induce inflammation. So this is the mouse in the lab, which started rubbing the eyes once we induced the inflammation. So we took 4 animals who were controls. 4 animals we induced inflammation by eye rubbing only. In 4, inflammation was induced by just LPS treatment, and in 4 by doing both. So what we observed in them that there was increased MMP9 expression and decreased LOX expression after the eye rubbing. So coming to the in vitro model. We again induced inflammation in the corneal epithelial cells, and we looked at the activity now of MMP9 and LOX, and there was an increased MMP9 activity and decreased LOX activity. The second question is, can we have a novel therapeutic agent which can negate MMP9 action at the molecular level and upregulate the LOX effect? So trehalose and batimastat were 2 compounds which fulfilled this criteria. So trehalose basically prevents formation of new MMP9, and batimastat binds to the existing MMP9 and prevents its action. Trehalose also promotes autophagy, which improves the cell health. So again, coming to the animal model, we induced inflammation as I described before, and then we treated them with batimastat and trehalose individually and then together. Again, we noted that there was increased LOX expression and decreased MMP9 expression once after the treatment. We did the same in an in vitro model. So here we treated epithelial cells which were under inflammatory stress with batimastat and trehalose. So here the blue box is a normal cell which has normal basal LOX expression. In the red box, there is reduced LOX expression after the inflammatory stimuli is given to the cells. In the yellow box, we can see that there is a regain of the LOX expression after the cells which are under inflammatory stress are treated with batimastat and trehalose. We also looked at the activity of the LOX and MMP9 after treatment with batimastat and trehalose, and there was again a decrease in MMP9 activity and increase in LOX activity. So we did a collagen gel contraction assay model basically to assess the functionality of this entire experiment. So it functionally improved the tensile properties of collagen gel, which contain healthy and keratoconus primary stromal cells. So batimastat and trehalose treatment improved the functionality as well. So to summarize, what was known is that there is an altered extracellular matrix status, decreased LOX, high MMP9 in keratoconus patients, and these increased inflammatory factors are also seen in the tear profile. What this study added was that trehalose and batimastat de-repressed the LOX levels in the in vitro and in vivo models and also in the animal models. However, the step forward will be the human clinical trials and regulatory approvals. Thank you.